Hello, beautiful light-filled souls. Trisha Barker here. I'm so excited to be talking with Dr. Kari Rollins today. And I've lived in Fort Worth for over 10 years, 11 years. And I've heard so much about the great work that you do. So many times people have said, you have to meet Dr. Rollins. You'll just love her. And I finally did. It took a pandemic for me to meet you, but I'm so happy to have you on my show and to talk about healing today.
Me too. I'm very glad to be here. And I didn't know you lived for so long.
I know, time flies.
Yeah, you taught at TCJC, so I know you've been here for a while.
Yeah, well, TCC, they opened the new campus in 2009, and I was one of the founding members. And so I've heard a lot about the work you do here in Fort Worth. And I know that we were talking before the show, and you wanted to be a veterinarian, but you ended up getting into osteopathic medicine. And that fits really well with your yoga practice. You're called the Yoga Doctor, and we have the Wellness Center here and Raja Yoga, which you're a part of. So tell me how that started, how you were interested in becoming a veterinarian and then switched.
Well, I think I just always was drawn to animals. I just related to animals. I love dogs, and I had a horse and cats, and I just really liked animals. So I thought that would be a great career. And I didn't realize vet school was harder to get into than medical school because there's not very many vet schools. So when I didn't get in, then I applied to osteopathic school. My dad encouraged me to do that. Actually, he was in a fraternity that when he was in school that actually he lived with osteopathic students, and he told me I would probably like that career, and I followed his advice.
And so
And
you've been into yoga too. Was it your parents who got you involved in it? You're in yoga since a child?
yes, my dad had back pain, and I remember this. I don't remember how old I was, but I remember it was around the time Marilyn Monroe died. Because I remember the conversation going on in the room about her. And my dad had back pain, and he was talking about his back pain. And he got a little book on yoga. A doctor suggested he get a book on yoga, which I found really interesting in Kansas City in the 1960s, why he would be given a book on yoga, but he was. And he actually practiced them and said it really helped him. And I picked up the book and read it cover to cover, and it just resonated with me. There was something about it. The word ahimsa in that book, ahimsa means non-harming, not harming other things. And that resonated with me. I became a vegetarian when I was 17 because my family was pretty much heavy meat eaters. But when I went away to school, I became a vegetarian and practiced yoga as much as I could from this little book. And then as I would go to a library or something, I'd find more books on yoga, and I'd check them out and read them, and practiced a lot. And, then I actually started teaching yoga after I graduated from medical school at UNT, teaching it to the physicians and the students. I joined a great program there. It was called Personal Wellness. And the program was designed to help medical students stay healthy through medical school. It was very innovative. And they'd written a goal statement about how they wanted physicians to be role models of health in the community and help promote health. And that was all in great alignment with what I wanted to do. And so I started teaching, and after a couple of years, I realized that, it was a little, I didn't really fit the university kind of faculty real well. I was a little more fringy on. I just realized I needed to move on, and so my husband Michael and I opened the Wellness Center in 1985 or something like that.
And was that because you felt like the medical profession wasn't addressing healing, or why did you open the center?
Well, the environment at this school was, there was a pressure to conform. They didn't even like the way I dressed, because I was a little bit of a hippie, and I kept getting books on my desk how to dress professionally,
Oh.
I enjoyed being the school environment. I enjoyed the students, but I realized that it probably wasn't going to be a good fit as I grew and wanted to do more different things. And I'm really grateful for the experience I got there, and I got to study a lot and work with people. But I just think it was time for me to move out on my own. And so we did. And started a little wellness center off of Vickery Boulevard, and we taught yoga, like, I don't know, a couple classes every day. We taught a lot of yoga and saw people privately, and we were, able to stay in business, and it just kind of grew from that. So um, it was, some people thought I was out of my mind to leave a university job and go start my own business somewhere in a little hippy dippy place, but it was the right thing for me. And, uh, and so my husband Michael, um, he was an artist, and it was funny because I wanted to be an artist, and my dad said, "No, you shouldn't be an artist. You can't make a living like that. You need to be a physician or need to be a doctor." And his father was a physician, and he said, and he wanted to be a doctor. And his dad said, "Oh no, it's too hard being a doctor. You need to be an artist. You have so much creative talent. You need to be an artist." So it's kind of funny because we shared, he was, that we crossed over between art and music a lot, and we taught together and had, we just loved what we did. It was wonderful, and seeing patients and teaching them yoga. We had a little cute little studio.
What
And,
I'm most interested in is, how has integrative medicine done or worked miracles that perhaps traditional medicine did not work? So I know the Wellness Center focuses on a lot of different techniques. So what have you seen?
well, a couple of interesting case histories I can think of. One was a medical student, and he was kind of overweight. He had a full-blown gallbladder issue. He had gallstones and abdominal pain and vomiting, and they wanted to take out his gallbladder. And I said, "Yeah, I think we can do without that." And I gave him a medication. It's actually a prescription drug that dissolves gallstones. People don't know that there exists a drug. Yes, ursodiol is the medication that dissolves gallstones. But we had to treat the acute symptoms with acupuncture and herbs, and long story short, 6 months later, his gallbladder was normal. The fatty liver he had was gone. He'd lost like 60 pounds, and he never has had any gallbladder trouble since. I also remember a case history of a guy who had double vision, diplopia, and he was legally blind, and he came to me because he was miserable. He couldn't read, he couldn't drive, he couldn't do anything, he could just sit at home, and he was going kind of crazy. So I had a feeling that his eye issues were related to the liver, because they say in ancient medicine the liver opens up to the eyes. And in fact, he did have issues with he had a high toxicity. He had environmental toxins and heavy metal toxins. And when we gave him antioxidants, actually he has normal vision now. He has completely normal vision. And there's another patient I've been treating with retinitis, another eye problem. And she's still struggling, but she's healed a lot of her issues too. And her same thing, had some issues with the liver and high toxicity. So, but a lot of what I see is back pain, chronic fatigue, a lot of diagnoses that are kind of vague in our culture, like chronic fatigue is just basically labeling symptoms. So finding out, well, what's the root problem? And it's different for each person. Chronic fatigue can be gastrointestinal problems. It can be, more brain dysfunction. It can be neurological. There's so many things that cause chronic fatigue, and you have to be I say, a good detective. You have to be able to kind of sniff down the path. And I use I use traditional Chinese medicine, I use nutritional medicine, I use lots of different things and modalities to try to figure people out. Genetics is helpful, to look, are you gluten sensitive, are you lactose intolerant? Neurotransmitters can be determined by genetics. So there's a lot of things that I look at to try to figure out the puzzle.
You have a brain scan too that I've heard about, right?
Yeah, the scan is a really cool piece of equipment, and it's covered by insurance really well. and it measures your brain waves as you respond to both visual and auditory stimuli. And based on how your brain is responding, it can accurately diagnose, do you have anxiety? Do you have depression? Do you have ADD? Do you have ADHD? Do you have PTSD? Because I've seen many, many misdiagnoses, because like a woman came in and she had the diagnosis of dementia. And when we did her neuroscan, she did not have dementia at all. She had really bad PTSD. And when she told me about her childhood, it was like, oh man, no wonder you have problems. And so we went on to work on that, and she's actually doing really well. But she did not have dementia. So the brain scan will do what's called neurobiofeedback, which feeds back electricity to the brain to normalize the brainwave patterns, which has been amazing. And that's not covered by insurance. The Neuroscan is, but the treatment isn't, because there haven't been enough studies done on it yet. It's pretty new. But I've been really impressed with how quickly people respond. And then we combine that with meditations, because in Kundalini Yoga, there are specific meditations for different psychiatric or psychological issues. So I combine the meditations, especially for people that can't afford biofeedback. We work with meditation, and it definitely changes brainwaves.
And I'm going to get to that, because your classes are great because you bring this knowledge of the medical profession and what people are trying to overcome. And one of the things that really stood out to me that you just said is you treat people in a variety of ways. So I've had great results with Chinese medicine. And then at another time, I've had good results with acupuncture here for this issue, but not with this issue. And it feels like it's a journey, like healing is a journey. And it seems like I've always added layers to it. And perhaps yoga is a new layer that I'm adding to healing. And it is fascinating to me. But what works? So a lot of my viewers resonate with me because I write about complex PTSD. So trauma in childhood coupled with trauma as an adult, and how do you deal with the effects of PTSD? So what are some helpful tips that you have for people or on their journeys?
You know, the most effective things to start with are learning to regulate your nervous system, because with PTSD, you're in fight or flight all the time. You can't get out of it. And there's two ways to access your autonomic nervous system. It's simple and it's profound. The breathing is both conscious and unconscious. So when we breathe consciously to calm our nervous system, we make our exhale longer than the inhale, and you hold your breath out. And that immediately calms your nervous system down. And then you're more aware of when you get anxious, you start breathing more rapid and shallow, and you start breathing from the chest. Well, that puts you in fight or flight. And quite honestly, most people are in fight or flight all day, because they're breathing here. They're breathing, lifting, using their neck muscles basically to breathe. If you breathe from your navel, then it calms your nervous system down. So paying attention to, there's a lot of work with breathing that you can regulate your nervous system. They say in yoga and Kundalini Yoga, they say it's called navel point strength. It's the ability to pull your navel towards your spine. They say that does three wonderful things. One is, it's good for your digestion when you breathe here, because that stimulates the movement of food through the digestive system. It's good for your low back, because when you pull your navel back, it supports your low back, so you sit up better and you hold your spine up better. And the third thing is, they say it gives you nerves of steel, because when you can pull your navel back against your spine and hold it there and hold your breath out, you are always calm. And that's the biggest and most important factor in people who have anxiety or PTSD, is to learn to regulate your breathing. So again, there's 4 parts to the breath. You can inhale, you can hold the breath in, you can exhale and hold the breath out. And when you exhale and hold your breath out, that's what calms the nervous system. But it takes, your mind is saying, breathe, breathe, breathe. And the other part of you has to say, no, I'm going to hold my breath out for 5 seconds. It's not going to make me faint. I can do this. So you hold your breath out, and then you keep doing that, and then everything starts to calm down. And the other process that we have both conscious and unconscious regulation is eye movement. So you blink your eyes if someone tries to poke you in the eye, but you can also blink your eyes consciously. So when we calm the muscles of the eyes, like you did eye movement therapy, right?
Yes, yes. Rapid eye movement therapy was very helpful.
Yes. So there's simple eye exercises in yoga that calm down your nervous system by relaxing your eyes. And there's a kriya called for inner and outer vision. It's all on gazing at different places, like you gaze at your brow point, you gaze kind of up and out the top of your head, you gaze out as if you have eyes in the back of your head. And all this eye movement puts pressure on the glands in the brain, the pineal and the pituitary, and you start to secrete endorphins. So the pineal gland secretes a lot of endorphins. Even the Egyptians knew that. And so when you do these eye movements, you start to secrete endorphins and you get this feeling of euphoria. And that's a very powerful way of changing your nervous system. And you don't have to, not that I say therapy is bad, it's wonderful, but you can do therapy on your own, sitting in your own living room or your own bedroom. You can do your own eye therapy that's very powerful.
And you
So those
teach, and you teach these things in your classes, right? So you have, do you do medical meditation? Do you have a workshop with that?
we're doing a workshop next on PTSD, and I'm working with a friend of mine that's a social worker, Linda Staley, and that'll be a workshop coming up the first weekend in October. But I want to do, actually, I have aspirations to do a lot of different workshops on different conditions. Emphysema is another one. Chronic obstructive pulmonary disease and emphysema is another illness that breathing exercises can be incredibly helpful. In fact, there's a case history in the book, Meditation is Medicine, of a guy with end-stage pulmonary disease, and he's given 2 years to live. And he was given a meditation by an MD that practices Kundalini Yoga. And long story short, 2 years later, 5 years later, he has normal lung capacity.
Wow.
Yeah, there's a lot of things I want to teach, and workshops are a good way to start reaching out to the general public and giving more information. I also have on the Udemy website, I have a bunch of videos that are previous workshops that I've done. But
I'm curious about what medical meditation is. So that's somewhat new to me. I've practiced many forms of meditation, but I'm curious about that one.
Okay, so that's a name that came about because in Kundalini meditations, and I'm sure you've observed, they're more complicated. So like when you do mindfulness, you're just kind of observing your thoughts, and it's a wonderful practice. I'm not trying to take away from it. I practice mindfulness too. But when we're dealing with these more complex illnesses, we have to engage more parts of the brain and make connections with the brain that aren't connecting. So like if you do, like the Kirtan Kriyas where we do finger tapping, this meditation was studied by the Alzheimer's Institute and found to reverse dementia. So you're doing finger tapping, and if you look at the pictures of the brain, what part of the brain goes to what part of the body, the hands occupy the biggest space in the brain, more than your whole leg. And so when you're moving your fingers, and then you're also chanting a mantra where you're moving your tongue, the tongue also has very precise movements. A lot of innervation of your brain goes into the tongue. So you're moving your tongue and your fingers at the same time. You sometimes have a gaze that you're looking at, and you have a breath pattern. Those integrate many different processes in the body to have a much more complex effect on the body-mind system than some of the simpler meditations. And they have to be, these meditations really need to be taught with some guidance, especially if you're having problems, because to tweak them and kind of attune them for each person takes a little bit of, it's better if you have a little bit of advice and someone who can guide you a little bit.
Yeah, and I just have to interject here that I just interviewed a energy healer, pretty powerful energy healer, and we were talking about how sometimes energy healing puts you on the path of healing. It opens up some doorways, but then you have to go do some things to heal. Go see a doctor or start a practice. And so if someone joins your medical meditation class for a specific issue, that's deeply designed to help them at a deep level. And I think it can be combined with energy healing, right?
Yes, of course. And I find, there's the patients that I have that don't want to do anything. They're just not inspired. And that's fine. Everybody has the right to take care of themselves the way they want to. But the people that are willing to work can actually create a lot of change in their body. And so those are the people that I'm inspired to help, the ones that are motivated. And I'm not saying I don't work with people who, I work with whoever I ask for help, but there are some people who are a little more inspired to do something proactive, and other people want to be a little bit more passive, and that's fine. But I really, there are things to really help people who are motivated and want to do something different.
Yeah, so Kundalini Yoga is new to me. I'm really enjoying it. But what do you think is the big difference between Kundalini Yoga and just regular other types of yoga for people who haven't tried it?
That's a good question, and it's it's not a succinct, easy answer. It's kind of a long response. But so I taught Hatha Yoga for about 20 years before I found Kundalini Yoga, and I still practice Hatha Yoga. I don't believe there's one kind of yoga that serves everybody. I think all the traditions of yoga have benefits, and they all have value. The Kundalini Kriyas and Kriyas are sets of exercises, and the meditations, I think, have a more powerful effect, again, because they're combining posture with movement, with breath, with mantra and mudra, all these different things, again, combined to make the effects. They call it the fast track. In other words, you can hold a Hatha Yoga pose for 15 minutes, or you can do it with breath of fire for 2 minutes, to get the same effect. So it has a way of accelerating the effects and deepening the effects, so it works faster. And not that fast is always good. Some people can't do breath of fire because it makes them feel too spacey and they get anxious. And so again, I use all the traditions of yoga. They all have value. But I was drawn to it because of the ability for it to change people quickly, and also because it was organized in kriyas, or sets of exercises that have a purpose. So there's kriyas for the liver. So if I have someone with a liver problem, well, there's kriyas for the liver. If I have someone with there's kriyas for depression, there's kriyas for the gastrointestinal tract, there's kriyas for all these different health problems or areas of the body, working on different areas of the body. So I found it very easy to say, okay, well, we can do this medication, but you can also work with this pose because it's going to help that organ inside of you work better. And so that's how I kind of got to practicing more Kundalini Yoga. And I found it very effective in a short period of time. Man, it really changes you.
And one of the things I liked about your class is you seem deeply tied to it yourself. You mentioned doing many of the poses in the morning yourself, and you found great benefit for them. What is your personal journey and practice like?
Well, it might changes all the time, but currently, I get up an hour and a half early to I do probably 45 minutes of stretching yoga. I don't really do a kriya. I do some hatha poses, some kundalini poses. It's kind of like based on what my body needs. But I do quite a bit of stretching early in the morning. And right now I'm doing the meditation called Sudarshan for 22 minutes. And that's that one. You do all the abdominal pumping, um, and I like that. So I've been doing that for a year. And I when I feel like, okay, I'm ready to move on and do a different meditation, and I'll do that. But I'm still feeling like that's a good meditation for me to do. And the reason why is, all this abdominal pumping that you do helps you to decompress your back. It helps you to pull up and lengthen your spine. It helps to push blood to all your internal organs. And it helps me to, as we get older, we tend to shrink. And I found myself shrinking. Is like this meditation has really helped me to kind of like lift up through my spine and hold myself better. So, everybody has problems, even yoga teachers have to work on themselves because, we all need tweaking. We all have, it's like having a car, it needs maintenance.
Yeah, it's true. And what about people, though, who are pretty desperate? Because sometimes I come across people who are really looking for a health breakthrough. Where do you begin with people when they come to you and they have like a multitude of issues?
Well, it takes me, I spend an hour with new patients because some people are very complicated and it's not the same for everybody. I have to take a really good history. I have to examine people. I have to understand kind of like psychologically where they are, how much effort do they want to put in. There's kind of an assessment of mental, physical, spiritual values that I have to kind of understand before I can really know what to do. But often people who are in crisis, things like acupuncture work really fast, and I work with Dr. Lai from Taiwan, and I call him supernatural because he really is. He's supernatural. He's he started learning at the age of 10 from his grandfather, who was a very famous physician, and he does things that it's like, I don't know how you do that, but I'm glad you're here. He can take the pulse of the woman, just for example. If she's more than 3 months pregnant, he'll tell you the sex of the baby based on her pulse.
Oh, wow.
Yeah. So, but anyhow, he's really, so sometimes if it's more crisis management, I might do that. I refer to, of course, I use Western medicine. If it's, I've sent people to the emergency room. I'm like, no, I think you have appendicitis. You need to go to the ER.
It's good to know.
It just depends on what's going on. If someone's got a urinary tract infection, well, sometimes we use herbs, but I'll use antibiotics if it's just what's going on. Like one woman had a mesh in her bladder and she had to go around with like IVs all the time because she had chronic infection in her bladder. And she saw Dr. Lai and she's off antibiotics now. And so these, it depends on the person and the problem, and some things are easy to fix and some things are really hard to fix. And
Out of curiosity, I have to ask about medical mystery. So, I know someone who has a rare skin disorder that is causing, the way she describes it, I'm not in the same town with her, but like pus on her skin and just some sort of bacteria, and doctors can't figure that out. Do you come across people with mysterious illnesses that get cleared up?
all the time. And so skin problems can often relate to GI problems, gastrointestinal problems. Like, for example, I had really bad acne when I was young, and I found out I was lactose intolerant, and I didn't want to believe I was lactose intolerant. So I said, no, this can't be, because I really like dairy.
Yeah, me too. In fact, I still will eat it and I will still break out on my neck. I'm like, I can't not have cheese sometimes.
Realized you can take the lactase enzyme, but as soon as I got rid of dairy, my skin cleared up, and it was just like, whoa, wish I'd known that a long time ago. But it can be so many different things, and sometimes it has to do with circulation. For example, one of the things, they do pulse diagnosis in ancient medicine, and one of the things that you feel in people who have skin problems is they call it wind, but they say that wind, like air blowing around, your pulse rises to the surface. So, when you put your finger on a pulse, sometimes you have to press a little bit. Well, in this case, you don't. The pulse rises above the surface. You can almost see the pulse in someone. And that means their circulation is coming to the surface of the body. It's not going deep inside the body, which is not good because your internal organs aren't getting perfusion. But it will happen in certain conditions, and then people will have rashes because everything starts coming out through the skin because their internal organs aren't working. So that's actually treated with Chinese herbs really, really well. And you have to move the circulation back deeper. And these are people that are typically stressed or anxious, or there's something where their energy is going out here to the outside world. They're focused out here, and the circulation doesn't move deep. They say it's like if you have a country and you send all the army to the borders and there's nothing to protect the inside of the country. They say that's what that's like. So
And
there
what
are
would,
a little.
oh, maybe you were going to tell me this. What are the perhaps meditations that would help in that instance?
Well, in this case, I would use Chinese herbs and acupuncture, but but physiologically, what's going on is people are stressed and their focus is out here. You know, they're troubled, they're stressed, and they're looking at everything out here, and they're not going deep inside and finding that inner peace and that groundedness inside of them. So yes, there are things that can help that. And one of the things, you know, I really believe in integrating a lot of things, but Tai Chi or Qigong, where you do kind of real exercises where you kind of ground yourself and real slow movements, and you kind of learn to relax. Those kind of exercises are really helpful for those kind of people. Nothing where you move fast, certainly no breath of fire. These people need to calm down and get a better sense of how do you um, shut down on the you know, they're in fight or flight, they're getting overstimulated out here, and they got to close their eyes and go deep inside and let all of this kind of calm down, and then their circulation starts to improve.
That makes a lot of sense. So thanks for answering that. I also come across a lot of people who talk about Lyme disease. Do you see that often? I mean, that's like kind of a common
Last year
thing.
I was hiking in Arkansas and got several tick bites and didn't realize it, and I was pulling ticks off of me, and one of the ticks had got it pulled off, and the head was still left, and I got Lyme disease. And of course, I took antibiotics, you know, because I knew if I didn't take it, I was going to be in trouble. I've treated Lyme's for a long time. And once it gets past that first stage and becomes a chronic illness, it's problematic. It's hard to get rid of. So I took my antibiotics and it went away. But chronic Lyme's is not an easy thing to treat. And it's, we don't understand Lyme's. You know, it acts like sometimes more like a robot than something that's organic, and it can invade and live inside your cells, and it's hard to identify. I have a microscope that you can kind of see some of the Lyme's problems inside the cells, but it takes it takes, for as much as you want to kill Lyme's, you have to strengthen the person's own immune system and build up their body function, because as long as that's depleted and it's low, whatever you're going to do isn't going to work. It's going to keep coming back, because you have to, they say in Chinese medicine, treat the terrain. In other words, like if you have a garden and it's got soggy soil, it's not going to grow good plants. No matter what kind of fertilizer you put on or what kind of good seeds, you got to drain the soil. Well, some people have too much water in their body. They call it dampness. Some people have too much heat. They're too hot. Some people are cold. Some people are dry. You have to balance out the body chemistry in order for the body to start working right so it can fight infections like Lyme's. So it's not all about kill the Lyme's. It's about how do you strengthen the immune system and make that person capable of dealing with Lyme's. And yes, I know it can hide in cells and be hard to treat, but you use enzymes and you can use a lot of things, but the first step is you gotta make the garden soil healthy, which is, you know, the tissues in your body have to be healthy. And that takes nutrition and, you know, lots of support, and it's different for each person.
Yeah, great answer. So this is kind of a broad question, but what would you like to see happen in the current medical profession? And what would you like to see happen for people?
You got to get money out of healthcare, because right now insurance companies and pharmaceuticals are driving the practice, and it's horrible. Physicians have 15 minutes to see patients, and you're busy trying to document all the things that insurance requires in order to get paid, and you don't have time to actually listen to the patient. And then you're forced to give certain drugs, and you have to hassle on the phone and deal with the pharmacy. It's such a hassle to deal with insurance and the restrictions on what you can and can't do based on your reimbursement. And it's all driven by pharmaceuticals and hospital corporations, and it's corrupt as can be. And it's not about fixing the patient, it's about filling out paperwork. And that's where I didn't take insurance for a long time, because you can only do so much, and then those are their rules. You got to follow their rules, and it doesn't make any sense. It doesn't make any sense at all, and we're stuck.
True healing, it has always seemed to require out-of-pocket money and out-of-pocket, time and dedication. I mean, I personally spent 10 years, on healing and trying things that both insurance paid for and didn't pay for. And I think a lot of people have been on those healing journeys where they've tried a multitude of things. And, at some point, maybe it's cumulative, the many things that you've tried, but maybe there are certain things that work better than others. And so it's fascinating.
And it depends on the person. And I understand it's not an easy answer, but the thing is, it's based on profit right now. Almost like the problems with, that I watched last night, the documentary about the social dilemma. It's all about money and who's making the most money. And it's like, no, this is terrible. Whether we're talking about insurance or the internet or anything else, we have to reevaluate what we're doing and come up with a better answer, because it doesn't make any sense. People are spending a lot of money on insurance and not getting good health care. And, it's frustrating on both ends. It's frustrating on the patient's end, and it's certainly frustrating on the physician end too. And yet you're stuck with that. What are you going to do?
Well, I like the fact, though, that you do help people take healing into their own hands, and your classes are very informative and beautiful. So I think the workshops probably are as well. And that focus on healing is a very personal journey for people. What do you say to people who may join, from online, and they are pretty isolated in life right now and they can't come to a class? How best do they get through these times?
Well, I think a practice, I tell people that to start a practice, you have to commit to doing something. And it's your time, your personal time, to take care of yourself. And we take care of other people, and we take care of our house, and we take care of our pets. But what are you doing to take care of yourself? And so we talk about setting up a practice. And the way you set up a practice is you first of all find a place at home or somewhere that you want to practice. It could be on your front porch, it can be in your bedroom, it can be in the basement where nobody can see you. You create a space and you make it nice by putting a rug there or a picture or a flower. And you pick a time of day that you go to that place to do your practice. And you make a commitment. And I tell people, don't overcommit. It's okay to commit to 3 minutes a day just to start, because you could probably do that. If you commit to an hour, you're probably not going to do that. So commit to something for 40 days. If you do a 3-minute calm heart meditation every day for 40 days, you've created a habit. And so you keep changing your practice according to what you want to do and what your goals are. And you grow it like a little plant. You fertilize it and you water it, and you go to your little place every day and you do your practice, and you grow spiritually. It empowers you, and you realize, I handle stuff better because I did my meditation. I heard a guy talk about this once, and it was such a cute analogy. He said, okay, so when you button your shirt, if you get the first button wrong, you're never going to button the shirt right. Okay. So he said, when you get up in the morning and you do your prayer and you do your meditation, it's like getting the first button right on your shirt, that the rest of the buttons, the rest of the day is going to be okay. because, you started right.
And I like
And
that. That's cute. Yeah, so you do have online classes in the evenings and some on Saturday mornings. And people, if you're watching in YouTube land, you can join Dr. Rollins' class and get information. What I like about your class is my readers and my viewers know, I'm fused, and you help in the class with people's particular problems, how to adjust and how to move past that and be safe.
right, because nobody's the same. And there's people who are super flexible and everyone is saying, wow, they do their yoga really good. They don't have any problems. I'm like, oh no, they have their own problems. Because they're hypermobile, they're unstable and their joints pop out and they get muscle strains really easy.
Wow.
No one has a perfect body. No one gets away free saying, oh, everything I do is easy. There's always something we have to work on. And that's a good teacher should be able to kind of see where you're having trouble and give you some ideas about how to work with that a little bit better. And that's kind of the frustration with me in the COVID thing is I can't see students online enough to say, well, you need to you need to straighten your legs, or you need to whatever.
Yeah, and that brings up a good point that I like to see my students when we meet virtually for them not to turn their cameras off. So if you join Dr. Rollins online, keep your camera on. She's there to help, not to, not to just judge you, but to help you.
Yes. And going around and kind of adjusting people like, well, put a pillow under your hips and you'll sit up better or whatever, it's kind of nice to give those little adjustments for people.
Yeah, so tell me, my last question for you is just a little bit more about the workshop because I'm excited about it, the PTSD workshop. What should people expect and what can be cleared and what can be helped?
So I'm going to be presenting with a friend of mine who's Linda Staling, who's a social worker, master's in social work, and she's done some special classes on yoga for people who have PTSD. And the whole language of how you teach is very different. You don't just say, okay, everybody, wind your legs and take your arms over your head and bend forward. It's more like, it's a much gentler language of if you feel like it, you can widen your legs, and if you feel comfortable to take your arms over your head, you can do that, or you can, you're given options. And one of the things like people with PTSD often they're not comfortable to close their eyes. A lot of yoga, we close our eyes and it's like, don't ask people to close their eyes because it's scary and you don't know what's going to happen outside of you. So we sometimes say, if you're comfortable to close your eyes, if you're not, then just kind of lower your eyelids a little bit. And so there's a different language when you teach people with PTSD. And so you invite people to do movements and it's very gentle, a lot of grounding, a lot of exercises where you use your legs to kind of put more energy in your legs instead of your head, to move it downward so you feel more connected to the earth. Breathing exercises, the eye movement exercises are really good. And there's another thing though I wanted to talk about that related to PTSD, and it's kind of a yoga philosophy thing. But we're said to, we have the body, mind, and the soul or the spirit. And they say in the theory of yoga that when God told the soul to go to earth, the soul said, I don't want to go. And so God says, well, you're going to go. And so he says, I'm going to give you the mind. I'm going to give you the mind to navigate the earth and that reality. And so, okay, if you give me the mind, then I'll go. Because the mind can take us to the divine. It can take us to God, but it can help us navigate through this realm. And so we have the body and the mind and the spirit. So the mind doesn't have inherent intelligence. The mind, they say, is like stallions pulling a cart. The mind can run you into the ditch and trample you. The mind has to be trained to serve the soul. And so that because it can run away with you. It can like absolutely smash your your self-esteem. So there's a lot of emphasis on watching the mind, even while you're doing postures. Where's your mind going? Is it staying focused on what you're doing? Or are you off, thinking about something else? We redirect the mind to come back. And the soul is our essence, and the soul doesn't come from earth. The soul comes from the cosmos, comes from the divine. And the soul cannot be harmed by anything in this realm. It can't be burned, it can't be cut, it can't be bruised, it cannot be harmed. And that's something I think people need to understand, that our emotions can be hurt, our feelings can be hurt, but there is a purity in everyone that no matter how much someone has tried to taint that, it cannot be tainted. There's a purity that is our essence that everyone has that cannot be taken away by anyone or anything. And that's what we have to tap into. That's what we have to remember and make that connection with in order to heal, because it is that's the aspect of healing, that part of us, the soul or the spirit.
Beautifully said. And I think maybe that's why so many people want to hear near-death experiences, because people tap into that soul that goes to the unconditional love on the other side, and all of these problems just seem like nothing. They just seem like, oh yeah, I'm done, I'm free, disconnected, happy, free, all's well. And then you return here and you're like, wow, this is heavy, this is difficult, this is challenging.
I want to go back to that place.
Yes.
We have to bring it into our life. We have to bring that into our daily life, and it is a practice, and truly that's why I meditate, is so that I make that connection with my soul, and I realize that all of this is a play. It's all it's not imaginary, it's happening, but it's not terminal. I mean, it's how we are evolving our consciousness. We're here to evolve our consciousness and learn, that. And so we make mistakes and we learn from that, hopefully, and we go back and we try again and we try to do it better. But there's no way that we're actually going to die, I mean, the physical body dies, but our essence, our soul doesn't die. And that's what I think we make a connection with in meditation, is that soul quality. And when you make that connection, I think whatever happens out here is, of course, it's important, but it isn't, everything's gonna come and everything's gonna go, and we can't really control it. The only thing we can control is the fact that we know we are part of God and we're part of this amazing universe, and we have lessons to learn. And so when we fall down, well, you put a Band-Aid on it and you get back up and you you try to do better, and so do I. But I think that's a really important thing that I think yoga has taught me, is to kind of step back from day-to-day ups and downs and remember why you're here. And it is to help people, just like you. I mean, the greatest joy that I get comes from helping people. It's not from a new dress or going to a great restaurant. It's when someone says, wow, I feel better, you really helped me. That's what I, basically I'm here for, and gives me a reason for being here.
Beautifully said. And that's just a wonderful way to wrap up this interview, and to leave on this note, is that every person I've interviewed in 2020 every single person has said meditation is the key. If you want to open up more to that divine light, if you want greater healing, if you want respite from these times, if you want to understand these times more, meditation.
Yeah. And there's all kinds. And so I think people should I know I practiced a lot of different kinds of meditation before I picked one that I wanted to practice, and I did it for 90 days. And I think that's what I want people to grasp, is there's all kinds of meditations. And sort of like food, sample a lot of different things, and you'll find one that just is like, wow, that's the one I want to practice for a while, and then change it when you get ready to.
Yeah, wonderful. Well, I will place the links to your classes below and your workshops below and websites. But thank you, Dr. Rollins, for talking with me. I'm glad after over a decade in Fort Worth, I've finally connected with you.
Guys, I feel like you're my soul sisters.
Well, thank you. And to everyone watching, be sure to check out upcoming workshops and upcoming guests and Dr. Rollins links. But thank you very much, and may you be blessed.